Automated External Defibrillator or AED is a device that used to detect lethal heart rhythms, which stop the heart from pumping effectively. It allows a rescuer to deliver electric shock or defibrillation to patients in cardiac arrest. AED is designed to be used by members of the community who have no medical training. AED is used on a person while undertaking CPR on an unconscious, pulseless, and one who's not breathing. The electric shock jump-starts the malfunctioning heart. It is proven to be effective for any healthcare professional to deliver defibrillator shock quickly in an emergency cases. AED removes the need for an operator to be able to interpret an electrocardiogram trace. Please follow the instruction ordered by an AED. First and foremost, switch on the AED. Next, attach pads to casualty's bare chest according to the manual. After that, connect electrodes to AED. Stop CPR and do not touch victim while analyzing rhythm is ongoing. If shock is indicated, everybody hands off and stand clear. Deliver the shock by pressing the button. After shock, resume CPR with compressions immediately. And, if no shock is advisable, resume CPR with compressions immediately. Please do follow these safety precautions when handling AED. 1. Try not to touch the person when the shock is delivered. 2. If victim's chest is wet, wipe dry the chest with a towel before applying the pads. This is a must because defibrillation should be performed on a dry surface. If victim is lying on wet surface, weigh the risk to patient of delaying defibrillation, and if the patient cannot be safely and quickly moved to a dry surface, all bystanders should move off from the wet surface as far as possible.
During the two rescuer CPR resuscitation, once the AED arrives, one rescuer will continue the compressing, another rescuer will operate the AED machine. Press the on button.
Apply pads to patient's bare chest.
Step number 2.
Plug in pads connectors
Apply pad
next
on the
to flashing
chest.
light.
Step number 3. Plug in the butt.
Apply pads. Plug in connector. Analyzing heart rhythm.
Step number 3.
Do not
Analyzing.
touch the patient.
Stop CPR.
Shock advised. Charging. Stay clear of patient.
I am clear, you are clear, everybody clear.
Deliver shock now. Press the orange button now.
Shock
delivered.
given. Continue CPR.
Paused. Begin CPR.